It seems like Kathy Griffin's lung cancer surgery yesterday turned out pretty well. She tweeted yesterday before the surgery that she was having half of her left lung removed. Kathy went on to say she's at stage 1 and her doctors are very optimistic. The most surprising part, I guess, to a lot of people, she's not a smoker. She spoke in a quick interview yesterday before the surgery.
Really just days ago, like I think 2 weeks ago, I was diagnosed with cancer. So as a friend of mine had said, how many kicks in the nuts can you take? And I'm like, my nuts are pretty strong, but it's a challenge.
So let's talk about this. Dr. Joseph Treat, of course, doesn't treat Kathy Griffin, but welcome to the show. I know you're with the Department of Hematology and Oncology over at Fox Chase Cancer Center. And Doctor, thank you for being with us. We've talked about this before on the show, but people always jump to the conclusion that if you have lung cancer, you were a smoker. What percentage of people get this cancer when they're not smokers?
Yeah, so this is a poorly recognized problem. For every 5 patients diagnosed this year with lung cancer, one out of 5, it's 20%, will be a never smoker, and it's really an astounding number.
How do you explain that?
Well, I think it's a different disease, and there are very different characteristics. First of all, Kathy Griffin's situation kind of fits the profile, meaning she's a woman.
She's a woman.
It is more common. Majority of never smokers who get lung cancer are women, and so it kind of fits what we typically see. It's also a very different disease. These cancers that develop in never smokers tend to have certain special mutations that can be exploited by very effective therapy, which comes in the form of pills. So it's a very different thing than the typical smoking-related cancer.
I guess you just got to go get your checkup constantly and make sure you know symptoms. What are some of the symptoms of a lung cancer?
Well, the symptoms are very common type things, which many can dismiss due to other factors. A cough, some increased shortness of breath, chest pain certainly would be high on the list. But the typical screening recommendations for a person to get a screening CT scan don't apply here, because those only apply to people of a certain age with a certain number of exposure years to cigarettes.
Now, what's the prognosis? You can take out half of one lung?
Yeah, I think she's going to do very well if indeed, and obviously we don't have all the details, but if this truly is an early stage, a stage 1 lung cancer, her chances of being cured are very high. She should do very well.
Let's go to smokers now, because again, that's 80% of the people that have lung cancer are smokers. If you stop, does the lung regenerate the tissue?
Yeah, so over time, the risk of developing lung cancer, if you stop, does fall. It never goes back to like it never smoked, but it does fall. And it'll probably lessen the impact of the development of emphysema, which is quite common.
Yeah. Doctor, thank you. And the best to you and the best to Kathy as well. We'll take a quick break.